Okay, so just a few things I forgot to mention when going over the carpals, metacarpals, and phalanges. Looking specifically at the carpal region with those carpal bones, I only spoke about the scaphoid and lunate articulating with the radius. However, the triquetrum also articulates with the ulna, and the lunate also articulates with the ulna. Okay, so the radius and the scaphoid for sure, large connection there. It does a little bit, radius and lunate have some articulation, but the ulna and the lunate and the ulna and the triquetrum are also going to articulate. So keep that in mind as we continue on. We're going to now move into the pelvic girdle. The pelvic girdle. So, as opposed to the pectoral girdle, there's only one pelvic because the pelvic girdle is considered to be a complete girdle, right? So, it does encircle the entire body. So the pelvic girdle is going to link the lower limb to the vertebral column. And we can see that bone there that we went over from the vertebral column, the sacrum, right? So that's where it's going to articulate to the vertebral column and the axial skeleton. Now, typically, when we talk about the pelvic girdle and just like day to day life, we talk about it and we call it the hip bones. I'm okay with some common names, right? That's totally fine and acceptable, but I really would prefer or like you to try and use the correct terms, all right? So, the pelvic girdle is actually made out of two coxal bones. Okay, you can call them os coxa, or I prefer to call them coxal bones. Okay, so one coxal bone here and another coxal bone here. And you can see them highlighted in blue. All right. And then together they make the pelvic girdle or the pelvis. Hip bones, it has no place here, okay? So because it is a complete girdle, it is more stable than the pectoral girdle, right? Um, However, that does mean that we have less freedom with movement in our lower limbs. So, if you think about what we can do and how we can stretch and move our upper limb compared to our lower limb, there's a lot more flexibility with the upper limb. And that's again because pectoral are incomplete and pelvic are complete. But the pelvic are more stable. So, it's a give and take. Okay, so let's look at this coxal bone, all right? So if you have me in lab, you will have to identify the coxal bone right versus left. However, with lecture, we won't be doing that, okay? With the coxal bone, each coxal bone, because remember there's two coxal bones that makes up a pelvic girdle, each coxal bone has three separate fused bones, and these bones fuse around the age of 23. So if you're above the age of 23, congratulations. The majority of your bones are fused. If you are not, give it a couple of years. 23 is a weird one. There's really not anything to celebrate around 23. So you could keep this one in mind and have a big party and celebrate the fusion of your coxal bones, presumably. That's on average. Okay, let's talk about what the bones are named. At the superior portion, superior and posterior, we have the ilium. Ilium. Okay, ilium. In the inferior and posterior portion, we have the ischium. This is a weird one. Ischium. I have heard people call it the ischium. Who's to say? No, I'm sure there is a right way. Ischium makes sense to me. Ischium, maybe. In the anterior and inferior direction, we have the pubis. This one's, we got to remember, it's pubis, not pubic. You will see anytime we talk about a marking on this bone or anything having to do with this bone, it will be P-U-B-I-C, pubic, but the bone name is pubis, P-U-B-I-S. Okay, now where all three of these bones fuse, you can see it makes this really large crater, really large depression, and that's called the acetabulum. Also, I've heard this referred to as acetabulum. I'm going to go with acetabulum. I honestly, I don't know. I don't know if that's the right pronunciation. I've been calling it acetabulum for my whole life. So, okay, so the acetabulum. Now, this is essentially a socket that is going to allow pressure and stability from our trunks. Okay, so we want this very large depression here so that we can have our day-to-day function. We're able to stand erect. We're able to have our thoracic cage be nice and tall. Okay. All right. Let's look at these bones and some of their marking on each bones. Okay. So this is called the ilium, but when we refer to the markings, we call it iliac. All right. Keep that in mind. And also, let's pay close attention to spelling here. I-L-I is ilium. Okay. I-L-I, not two L's. Sometimes when they're in some fonts, right, it'll be, like a capital I, but a lowercase L. So it'll look like maybe two L's or two I's or something like that. It's I-L-I. Okay. So we do need to know all of these markings because these are muscle attachment sites. And if we understand and identify them now, it'll help us so much later on. All right, so let's look at the ilium here. This is the anterior portion and this is the posterior portion. Also, it should be stated that this is lateral. You're looking at the lateral view of the coxal bone. Okay, going along the very top of the ilium, you have the iliac crest. If we move in a pattern, it makes things a little bit easier to follow. So you can either start at the iliac crest and move anterior and then go posterior, or you can make a nice pathway from one side to the other. I'm going to now go from posterior to anterior. All right. In the posterior side of the ilium, we have a marking called the greater sciatic notch. Greater sciatic notch. So for one, the greater sciatic notch is a notch, and therefore it does appear as a U shape, right? So we can see it's kind of, upside down, maybe it looks like an N, but we do see this greater sciatic notch. Now it's called sciatic because this is where the sciatic nerve passes through. All right. So greater sciatic notch. And as we move through our line, we have the posterior but inferior iliac spine. Okay. So it is on the posterior side and it's lower. So it's posterior, inferior. It's on the ilium. So it's iliac. And we call it a spine. Going superiorly, we reach the posterior superior iliac spine. So if you just recognize posterior versus anterior first, you'll be able to identify these markings really easily by just understanding inferior and superior. So from the superior iliac spine, posterior superior iliac spine, we can move up the iliac crest. And now we are at the anterior superior iliac spine. And then we can move down and come to the anterior inferior iliac spine. So I like to think of it as a pathway, and I like to draw these pathways out, making just a linear line of terms and having arrows connecting them, right? Not necessarily drawing the entire bone, but just having my pathway. I like to make pathways, right? Or you can start at the top and work anteriorly and then go posteriorly. Whatever works for you. Okay? So that's the ilium from the lateral view. Let's now go to the ischium. Okay. From this bone, we are posterior, right? So we're on the posterior side of the coxal bone. We have a spine, and so we call it the ischial spine. Okay, ischial spine. And then from that spine, we kind of have a little tiny curve, little tiny indentation. We also call this a notch. Okay, so this is the lesser sciatic notch. Greater flows into the ischial spine to the lesser sciatic notch. Then we have a tuberosity, which is just a really large tubercle. Okay, it's just kind of a rough patch. Another, again, these are all attachment points. Ischial tuberosity. And then as we move anterior, we have the ramus. And the ramus is just a connecting point for the rest of the bone. All right, then we move on to the pubis. So the pubis has an inferior ramus because it is on the inferior side. Then it has a pubic tubercle, and then above that, we're going to have the superior ramus. So this is where understanding our directional terms really comes in handy because it's really easy to name these portions just by looking at them and understanding their position relative to other bones in the body or relative to other markings as well. Okay, so that is all from the lateral view. Now this is the medial view. All right, so some of these are repeated, like up on the ilium, we have the anterior superior iliac spine and the anterior inferior iliac spine, right? We have the other posterior iliac spines. We have the greater sciatic notch. The only thing that's new here is that we do have an iliac fossa on the medial side. Okay, so we do have a shallow depression here. And then we have the auricular surface of the ilium. Where have we seen auricular surface before? Auricular surface, not articular, but auricular. How does the coxal bone attach to the axial skeleton? The sacrum. Yeah. All right. So the sacrum, the very bottom of the vertebral column, the sacrum also had auricular surfaces on both lateral sides of the bone. That is going to articulate with the auricular surfaces of both ilium. Okay. So those are really the only two new markings for the ilium from the medial view. Let's go to the ischium. There are no new markings, but we can still see the spine, the lesser sciatic notch, and our ischial tuberosity. And on the pubis, we still see our tubercle and our superior ramus and our inferior ramus, but now we're able to see this surface, okay? So this is called the pubic symphysis. Well, it really should be the surface of the pubic symphysis. The pubic symphysis is a joint that combines the pubis bones anteriorly. Okay, so because we don't actually see the other pubis bone, we can't really call it the pubic symphysis. It's really just the surface of the pubic symphysis where it would be occurring if there was another pubis bone. Okay, so let's just take a moment and identify here. Right here is I'm not going to use a pen. Oops. Right here is anterior and inferior. This is the pubis. Right here is superior and just kind of extending posterior, but also anterior. This is the ilium. The ischium is not in view. The ischium is sitting posterior and inferior. So because this is the pubis, anterior and inferior, This is a pubis bone, and this is a pubis bone. Where these two bones connect, this is the pubic symphysis. This is made out of fibrocartilage, connective tissue. Okay, and in a later lecture, we will talk about joint classifications and how we classify the pubic symphysis. Okay, but it is made out of fibrocartilage, connective tissue. Okay, when we look at the pelvic girdle, including the sacrum, right? And you can see the sacrum having the auricular surface articulating with the auricular surface of the ilium to make those sacroiliac joints, where we can have that combination of the axial and appendicular skeleton, right? But when we're looking at this, we have classifications of false pelvis and true pelvis. The false pelvis is essentially the superior portion, including the ilium. The true pelvis is the inferior portion, including the acetabulum and the ischium and ilium. Ischium and pubis. Excuse me. Okay. Now, we can also look at these pelvic girdles and be able to identify male versus female. Okay, so I love watching Criminal Minds and Bones and all these like crime shows, right? And a lot of the times they will hold up a bone that they just dug out of the earth and they will determine if it is a male or if it is a female. Okay? Now, there are specific portions of the pelvic girdle that allow us to do that. One of them is the pelvic brim. Okay, the pelvic brim we refer to as the inlet. Okay, the inlet. So, it's kind of just like the circle around the around the pubis and portions of the ilium. Okay, that is the pelvic brim. In a female, it is more oval shaped, so very wide. And in a male, it'll be more narrow and even heart shaped, right? So it kind of has like a point here with two extensions here. But really, I just always look for oval versus circle. Sometimes that is hard to identify. Sometimes looking at the pubic arch is a little bit easier. So the pubic arch, okay, and the pubic arch in a female is going to be greater than 90 degrees. Okay, so remember 90 degrees is a right angle. Okay, so we have greater than 90 degrees. So very large arch here. In a male, it'll be very narrow, very small angle here, less than 90 degrees. Okay, so these are markings or just features of the male and female pelvis or pelves that I typically will use. Okay, you could also look at the just generally one's going to be lighter, one's going to be heavier, or looking at the false pelvis, which remember the false pelvis is the pink up here, right? So the superior portion. The false pelvis will necessarily be like shallow, whereas the male, it will be deep. What we mean by shallow is see how the false pelvis is kind of wide. So, like if this was a bowl, it would be kind of shallow, whereas here it's smaller and narrow, so it makes it more of a deeper bowl. Okay. From a lateral view, we can also identify if we were just to look at one coxal bone, right? If we didn't have the articulating pelvis to see the pelvic brim or the pubic arch, we could identify from just one coxal bone. So looking at the iliac crest, the males will have more of a curvature, more pronounced curve, whereas the female iliac crest would be kind of less curve. Okay. And then the ilium itself would be less vertical. But again, that plays into the false pelvis versus, shallow versus deep. So if it's less vertical, it's going to be more horizontal, which means it's going to be a shallow bowl. If it's more vertical, it's going to produce a deeper bowl. So that kind of plays into the false pelvis again. Okay, I like to use the iliac crest as my indication, but of course, the greater sciatic notch, also, looking at the angle of that can be useful. Narrow angle for the male, wider angle for the female. Okay, so the pelvic outlet is going to be more so at the true pelvis, so it's kind of inferior, right? So pelvic outlet in a female is going to be wider, whereas the male, it would be more narrow. But again, if we were looking at from this view, we would be looking at the pelvic brim, which is the inlet. And again, it's wider and more oval versus narrow, right? So it's kind of just saying the different thing, just looking at it from different views, okay? These two are really the best for identifying male versus female. Any guesses as to why the female has such larger angles at the pubic arch and the greater sciatic notch, and why the pelvic brim, the inlet, and the outlet are wider? Any guesses as to why the female pelvic girdle is, by all intents and purposes, more wide and narrow than the males? Any guesses?